Let's discuss the coarctation of aorta in the book. A congenital condition characterized by a narrowing of the aorta, as I said earlier, usually distal to the origin of the left subclavian artery at the level of ductus arteriosus. This narrowing increases resistance to blood flow. Hypertension and reduce blood flow to the lower extremities. As I said earlier, epidemiology. Look at this, more common in males. Association is 50 to 80% of coarctation of aorta have a bicuspid aortic wall. Sorry, I said earlier that mitral wall, so here is bicuspid aortic wall. Pathophysiology, postductal, most common in adult. Narrowing is distal to the ductus arteriosus, resulting in different blood pressure between upper and lower limb. And preductal, the narrowing is proximal to ductus arteriosus upon associated with other congenital defect. So what happened? The narrowing, the after load increase, so the left ventricular pressure increase, causing hypertension in upper bodies because there is the blood is not pumped properly to the aorta. So over time this can result the collateral circulation develop, as I said earlier. Look my video. The left ventricular hypertrophy and heart failure if left untreated. If the clinical feature is hypertension, so what happened? The early sign, refractory or resistance hypertension, is common finding. Blood pressure discrepancy. What is the mean? Because the upper extremities, the upper limb, the blood pressure is increased, the lower limb is decreased, the arm and the legs. Murmur. Systolic murmur heard best over the left subclavicular area or the back. So the murmur may radiate to the back due to turbulence created by the narrowing segment of the aorta. For example, this is aorta and this is narrow. So the murmur goes back to because the turbulence of the blood. Symptoms: headache, nosebleed, and fatigue due to upper body extremities, blurry vision, and as I said earlier, look at this: leg pain, claudication, cold, lower extremities are weak, delayed femoral pulse due to increased blood flow to the lower body. Radiofemoral relay, differences between pulse, the radial and the femoral arteries. So what is the diagnosis? So measure BP in both arms and legs to detect discrepancies, assess to radiofemoral delay, and auscultate the systolic murmur over the left infraclavicular area and back. So imaging, the transthoracic echocardiography SPUS imaging test can show the narrow segment of the aorta and assess the function of the heart aortic wall. So the first imaging test is transthoracic echocardiography, and transesophageal echocardiography provide a more detail if the transthoracic echocardiography is inconclusive. Chest X-ray may show the three signs, as I said earlier, the rib notching agar collateral vessels, so pre and post stenotic dilation of the aorta. MRI is the investigation of choice or gold standard for diagnosis, useful for planning surgery or stunting. Cardiac catheterization provide direct pressure measurement across the coarctation and may be used in interventional management. So the management, first we control hypertension, ACE inhibitor, beta blocker give. Then regular follow-up, blood pressure monitoring and imaging. Interventional management is surgical repair, resection of the narrow segment, end-to-end anastomosis uses a graph. I said earlier, look at my early video. Indicated in severe cases of those complications: balloon angioplasty and stenting, minimally invasive, especially in older children. So the balloon. What caused the balloon angioplasty and stenting, especially in older children, and minimally invasive? So follow up for time management, regular follow up because the hypertension, aortic aneurysm occur and re-erection occur. So the complication: aortic dissection, aortic rupture, and persistent hypertension. So what is the common confusion? Because the congenital heart defect present with murmur with hypertension, and the coarctation associated with the hypertension, upper limb radiofemoral delay weak, and the arm is high femoral pulse, the high pulse, and the femoral is low pulse. So systolic murmur in the left intracerebral area are vague, associated with bicuspid aortic wall. So look at this diagram. So thanks to bear with me.